am Angelo Papastamos, and I am going to facilitate this session. You are at the intersection of transportation, health, and well-being session. I want to thank our sponsors again real quick, and so you can see them on the screen there. And without the sponsors, we really can't hold this, so we really appreciate all of their efforts. We have with us today two people that I really know fairly well, and I'm excited to, really privileged to be facilitating this and introducing them. I'll start with Elizabeth McMillan. She's the Director of Communications for UDOT. She has worked in the transportation industry for 13 years. She's got a wide range of experience, ranging from public involvement to policy and legislation. She believes that government can be a positive institution. And honestly, Elizabeth is like a leader of change for us, and it's really exciting to have her speak today. I can't wait to hear her. And then we have with us Sarah Hodson. And again, I've had the privilege of knowing Sarah for a while now, and really excited to listen to her today. Sarah is the Deputy Director of the Bureau of Health Promotion at the Utah Department of Health. Before that, she was the executive director at Get Health Utah. Is where I got to know her from. And so I can't wait to hear you both. And so I will turn it over to Elizabeth now.
Thank you, and just to check, are you going to run the slides? I just say next slide.
I don't know if I can I?
Oh, yeah, you can.
Okay, then yes.
Perfect.
Okay.
Awesome. Thank you. Well, I'm so excited to be here. And like Angelo said, we've been friends for a long time. He's one of the first people that I met when I got to UDOT, and I was so lucky that he was. So I'm going to talk just a little bit about how quality of life is related to transportation. I'm going to share how it affected me personally. So before I came to UDOT, I worked in Pleasant Grove, and I live at Traverse Mountain in Lehigh, so just up behind Cabela's and the outlets. And I used to bike to work sometimes. It was a lot less populated there when I was working in Pleasant Grove. And over time, things grew and it started to become scary. So I had to cross under I-15 going west, and then I would head south to Pleasant Grove. And that interchange just became too scary for me to navigate. There was a time when I thought a school bus was going to take my head off, and that was the end of that. And as things continued to grow and we changed the design of that interchange, I would say it was impossible to cross. And that's not really true. It was possible, but it was frightening and busy to the point that I was not willing to do it. As I've worked for UDOT on the TravelWise program and communicating a lot about transit, I thought, you know what, I need to walk the walk or bike the bike. And so I was waiting for some kind of kick in the pants for me to start doing that. And I got really lucky. We did the Tech Corridor project, which we completed last year. So even though I only live about a mile away from the Lehigh Frontrunner station, which is within walking distance theoretically, having the new configuration that includes pedestrian and biking facilities, it made it so that now that's not an impossible barrier for me to get across I-15, because I can go under, I can go over. There are lots of options for me now. So instead of being a wall, there's a pathway for me. Also, one of the interesting things that I noticed afterward was that there's a bus station that's within 2 minutes walking from my home that can take me to the Frontrunner station. And for some reason, when that wall of I-15 was there, I never really thought about the bus station as an option. But now that things have opened up as a system, I think about the bus station too as another way that I can get there. All of that is to say that when we have an integrated system with safe options, true choices, people make different decisions about how to use the infrastructure around them. Now, I'm lucky. I live in the suburbs. I'm solidly middle class. I have options. I can take my car and get on I-15 to go to my workplace in Taylorsville. But there are other people who have fewer options and different options. And this became really clear to me when I was I went to the US 89 interchange opening in August. And I met a couple of people there. So there was one gentleman who was telling us how excited he was for these projects because where he lives, we were making some changes so that his daughters would be able to walk safely to a park that was across from US 89. And that's a huge change. That's a quality of life benefit to be able to get to green space where you can connect with other people, you can play. And then there was another gentleman there who was on our steering committee. So he's a member of the community who comes to meetings and advises on how we ought to build the project, since we're doing a design build and are kind of building along the way. He's in a wheelchair, and so he was able to provide a perspective that our project team wouldn't have had otherwise. And that means we can build a better project. All right, Angela, go to the next slide, please. Thank you. When I got to UDOT 8 years ago, we were really focused on our strategic goals. So this is a slide from our new employee orientation. And this is what we talked about. It was all about the strategic goals. They are good goals. I have nothing against them other than they're like not parallel construction linguistically. But other than that, zero fatalities, absolutely safety is our top goal. Optimized mobility, that's the bread and butter, especially historically, of a Department of Transportation. And then preserving infrastructure. And these have not changed, actually. They're still part of our roadmap. These are still our strategic goals that we measure performance toward. But over time, they started to feel a little hollow. So I worked on TravelWise. It's part of how I became friends with Angelo since I arrived in 2013. And I think most of you are probably familiar with TravelWise, but we talk about alternatives to single occupant vehicle driving. So not just one person driving in their car wherever they want, whenever they want, thinking about things like carpooling or trip chaining or using transit or skipping the trip altogether. And that was becoming a little more ingrained in our culture. And it was certainly something that we were talking about publicly. I also have had the privilege of writing speeches for Carlos Braceras, our executive director. And one of the first things that I did with him was what I consider a seminal speech. It was the first speech that he gave as the executive director at our UDOT annual conference, which includes our employees and partners from the private sector, other public sector agencies, cities. So he asked a question. And he said, who here believes that it's our job to support transit? And there were a few timid hands going up, but it wasn't the entire room shooting their hands up immediately. But he talked about it more and more, starting at that point. And as we talked about it more, it became a public message, we talked and realized our strategic goals don't cover it all. They tell you what we do, but they don't tell you much about why we do it. You can go to the next slide. Thank you. So in 2019, we changed our mission statement to be more reflective of why we exist. It's brief, it's concise, it tells you exactly why we exist and what we're trying to accomplish. Now, what gets measured is what gets done. And by shifting so that we still have the strategic goals, but we also have this quality of life model, the framework, we can start to look at other things to measure too. So we have a new prioritization model that's based off of the 4 dimensions of this framework. And that is the start of putting numbers and data to quality of life dimensions. And then that was a springboard for some work that Angelo is working on with others to identify performance measures that also relate to quality of life. And so that's not just how we determine what projects should be, but it's how they performed. Did we do well? Did we enhance quality of life? And then we're also starting to ask questions about quality of life means to the public and how we can do better. Makes sense. We are stewards of public money and we're here to serve their needs. So in 2021, I'm going to share with you our research from 2021. We started asking questions about quality of life in 2019. So you'll see some of the baseline questions. The questions have evolved over time because we're still evolving as an agency as it relates to quality of life. But I was pretty surprised by the results. I'm biased, so I think transportation is the most important thing in the world. Infrastructure is so important to well-being. And then here's what we found. Angela, go to the next slide, please. So I am not alone. Utahns have a pretty solid understanding that transportation impacts their lives, and their perception of that impact is that it's mostly positive. We had focus groups too, so we got qualitative responses, and people unprompted noted that transportation helps connect them to their loved ones. It connects them to employment opportunities and education, and also gives them freedom, which they really value. Next slide. We also asked specifically about health, and we asked about both mental health and physical health. So this right here is how it positively impacts mental health. You can see that 58% of people responded that it does positively impact their mental health, which this was one of the most surprising ones to me, because there's research, Danny Kahneman did this famous study where he looked at 23 different things that people do throughout the day, and then they would measure, they would rate in that moment, how pleasant was it? How was that impacting their well-being? And commuting ranked dead last. Like, it was after cleaning toilets, it was at the bottom of the barrel. So for us to have a 58% response that we're positively impacting mental health is really remarkable. It tells you something about how people view what we have to offer as a system. All right, next slide. And then also with physical health, that's not as obvious. I would say in this case, we're sitting in our cars. There's not really a direct line for a lot of people between transportation, historically what you think of it as being on the roads, and then health. This to me indicates that as a society, we are starting to think about infrastructure as being a little bit broader than cars, because there's like no way that you're answering, yes, sitting in my car makes me healthier. So the definition of transportation is broadening. And this was really great to see that 52% of people think that we're providing a positive impact. And it gives me a lot of optimism that over time, as we continue to provide more, we can see this number go up. That's really the goal, to perform better. All right, next slide. So also, I did not explicitly mention that health is one of our quality of life dimensions in the quality of life framework. So that's why I shared that. And then connected communities is another one. So we asked about connections. And this question was about connecting with school and our work opportunities. So that's really high, 78%, like overwhelmingly positive response. And then next slide. And this one, to me personally, is really important because of its impact to well-being. So this question was about connecting with people that we care about. That's 84%. Really, really high. Great to see. And then again, connected communities. So transportation positively affects my community, 81%. Now, if we're going to talk about quality of life today, you're also going to hear a few other words. So you heard me mention well-being, and then we're also going to talk about health indicators. So Angelo, if you could go to the next slide. I mentioned that what we measure is what gets done in relation to the strategic goals, and that we're also starting to do more measurement around quality of life. And we're also starting to do some measurement around well-being. I just want to take a moment though to talk about some distinctions. They're a little bit nuanced among these three words, but I think that it's worth taking a few minutes to talk about them. So well-being is subjective. Go to the next slide, please. All right, so that is, it means that it's based on how well you think your life going, how well you think your life is going. Do you think your well-being is high? Angela, if you could go to the next slide. This is just a sampling of different instruments for measuring well-being. And the most challenging part to gathering data and measuring anything, as Sarah will discuss, is deciding which things are the most important to get to whatever your definition is of well-being. So I'm just going to share an example to illustrate that, if you'll go to the next slide. This is one that I like a lot. It's the satisfaction with life scale. And so you can just see a few of the questions that are on this. It's a very, very short, easy to use instrument, but you can see that these are questions that you would just answer that are subjectively, is your life ideal? Are the conditions excellent? Are you satisfied? So this one, it is getting at data, but they're all going to be subjective responses. And then next we'll talk about quality of life. You could go to the next one, Angelo. Oh wait, I think we may be on the wrong slides.
Do they go, okay, do they go back?
Yeah, if you don't mind. Back again. It should be some circles, of Venn diagram circle. Yeah, back again. Okay, there we go. So quality of life looks at objective factors. So this one, this is what Sarah's going to talk to us about. And there are a lot of different instruments for this too. And there are some things that are pretty stable. So I won't talk more about that because Sarah is going to get into that. But just that difference between well-being being subjective and quality of life being based on objective data is the important thing to keep in mind. And now I will turn it over to Sarah to talk about quality of life and health.
Great, thanks, Elizabeth. Yeah, Angelo, if you can go one ahead. Great, thanks. So yeah, I'm excited to be here and excited to be paired with Elizabeth and Angelo in this presentation. We have partnered together for a number of years, and they really are, I think, really forward thinking in the way that they think about transportation and health. So I just really value their partnership, and I'm happy to be here with them today. So I'm gonna, as Elizabeth said, talk a little bit more about some different health indicators, and maybe just help us think through the way that we think about health and well-being. And for example, this is some data that you can pull from the Behavioral Risk Factor Surveillance Survey for Utah. And this is asking people, the question they get asked here is, would you say in general your health is excellent, very good, good, fair, or poor? And then it's reported here as fair or poor. So obviously we prefer people have good, very good, or excellent. So for Utah, it's about 11% of people say they have fair or poor health. So this is an example of something that may be a little bit subjective. What is it that is contributing to that? Why do people rate their health in this particular way? And it also gives us a really incomplete picture of health. So I'm going to share a couple of other ways that we might think about looking at health. All right, next slide. So one might be looking at health behaviors, and these are things that impact health outcomes. So in this particular example, these two, the top is recommended amount of physical activity in Utah adults, and that's around 55%. And if you were in the Dr. Joy presentation, you heard lots about the benefits of physical activity. And so again, we might want to have more than half of our adult population getting that recommended amount of physical activity. The bottom is fruit consumption, so recommended amount of fruit consumption 2 or more times a day, and it's about 1/3 of adults in Utah. So this is a way of looking at health behaviors, and health behaviors have a link to different health outcomes. These two particular behaviors are related to diabetes, to cancer, heart disease, a number of different health outcomes. Okay, next slide. So here's an example of if we wanted to look at health outcomes, if that's how we wanted to define health by the outcomes that we see. This is diabetes in Utah in adults, and here it's categorized in local health districts. So there's 13 local health districts in Utah, and then you can see state of Utah and US to the right. So this might say, this tells us that 8.5% of adults in Utah have diabetes, but this also is not a full and accurate picture. Next slide. So if we look at, again, taking diabetes, adult diabetes in Utah, but in this case, we look at it by income level. And you can see that for adults in Utah with an income of less than $25,000 a year, it's significantly higher rate of diabetes than the state average of 8.5%. Here it says 8.8, it's a different year that it's looking at. And so what this shows us is a health disparity, and a health disparity is a difference in the outcomes that's linked to economic disadvantage. One way of thinking about it is health disparities are things that are avoidable, unfair, and unjust. And so when we want to have an idea of what does health look like in Utah, we really need to be thinking about all of these things, not just what is diabetes as a rate for the state, but when we look at particular populations, how does diabetes impact those populations? Okay, next slide. Another example where we can look at some health disparities is life expectancy. Next slide. So this is life expectancy by small area in Utah, and those are defined as these 99 geographic areas in the map on the left, and then on the right is just kind of zoomed into the Salt Lake Salt Lake City area. And I think if you click, there's two animations, Angelo. So Salt Lake City Avenues area here, which is that green kind of, I don't know, like finger pointing shape, where the life expectancy is 87 years. And then Rose Park, which is this blue right next to it. So two neighboring small areas in Salt Lake City, but a life expectancy of nearly 10 years difference in those two areas. And so why do these health disparities exist in this case? And it's often related to structural differences within those communities and what we call social determinants of health. And these are the conditions within communities that impact where people live, work, and play. And so we'll talk through what that means and how that helps us to define health and give us a clearer picture of what health is in our state. Okay, next slide. So social determinants of health, I think probably this is a term familiar to most of you. This particular way of categorizing them comes from Healthy People 2030. There are different ways of categorizing these domains, but Healthy People 2030 puts it into these 5 different domains. And these are the conditions, again, in the communities where people live and the circumstances that impact a number of different outcomes. And the photos on the right side of the screen there are all from Utah. And so these are, if you think about the natural and built environment where we live and the way that these might impact our health and our health outcomes. That second picture from the top where you can kind of see a road closed sign, that's from very early in the pandemic, if you remember, when there was an initiative to close some streets to traffic so that people had the opportunity to be outside and getting physical activity while they were socially distanced from other people. And that's a street in Salt Lake that my daughter and I went around and took some pictures of those closed streets to have some examples of that. So most of the things that are relevant for our conversation fit in this neighborhood and built environment section. All right, next slide. So here's another way of thinking about it, and maybe this is a more confusing image to look at, but this is called the Barheim model, and it's a way of thinking about health in all of its complexities. And so if you kind of look at the right side of this, where you have mortality, disease, and injury, and you see at the top it's labeled as downstream. This is maybe an older or traditional approach to thinking about health. Sometimes we refer to it as public health 1.0, where we're just thinking about morbidity and mortality, and those are the things that we're focusing on. As you move slightly to the left in this model and you see risk behaviors, those are things like smoking, poor nutrition, low physical activity. And so over time, there was a greater understanding that these behaviors, the impact outcomes. So if we want to try and address diabetes, for example, type 2 diabetes, then we need to have programs in place that address poor nutrition and lack of physical activity, and that's going to help to improve outcomes related to type 2 diabetes. This is kind of more of a public health 2.0 approach to thinking about it, individual health behaviors, health education, case management, that sort of thing. This is critically important, and so I don't want to imply that those programs and services are not important. They are, but it's also important that we have a more holistic perspective and think about what are the things that are contributing to those behaviors. It's not that people just either choose to be healthy or choose not to be healthy, but there are factors that influence and contribute to their ability to make healthy choices. And those are in these kind of more left part of the model, the living conditions, the institutional and the social inequities. And this is, as you see at the top arrow, moving more upstream. So if you hear people talking about we're moving more upstream in our approach, that's looking at what are the conditions and the structures that are in place that impact people's ability to make healthy choices and then impact their outcomes. So again, for the context of this conversation, you can see, and I think there's a circle around it, Angelo, in the living conditions, in that physical environment section, thinking about transportation and land use as really important contributors to the living conditions. Okay, next slide. All right, one more. This is the last, I promise, framework to look at. But this is from the Office of Health Disparities within the Utah Department of Health, and it's called the Health Equity Framework. And it's a similar but differently outlined framework. You can see at the bottom those social determinants of health and the community and place-based determinants. and that those things lead to people's opportunities to thrive in a healthy context, and those things lead to people being able to be healthy and productive and empowered. And on the left, it's a little bit simplified. You have the structural and social determinants of health that impact health equity, that impact quality of life. And I think Elizabeth's going to talk more about the quality of life framework from the Department of Transportation. So I think this is a helpful way of thinking about that. And again, in that community and place-based section, you can see housing, transportation, recreational environment, built environment. So all things I think people here today are concerned about and thinking about. And those are the things that impact our opportunities to be healthy within communities. Okay. So that is all of the kind of frameworks for us to look at and kind of think about as we move forward. All right, next slide. So I hope that it's clear that there is a really complex and interconnected relationship between transportation and health. And the one that stands out, I think, first in our minds often is the relationship to physical activity. That when we have better opportunities for walking and biking, more transit, communities designed in a particular way, that increases our opportunities for physical activity. And that's really important. But there's a lot of other connections beyond that, opportunities to get to employment, opportunities to get to services like healthcare and other services, being able to access healthy food. There's social cohesion implications of transportation and health, safety, air quality. So they're just connected in so many different ways that these conversations and these partnerships are really important as we move forward. Okay, next slide. So I'm going to take the last few minutes of my time to talk about a new project that we are working on with the Department of Health, Bureau of Health Promotion, with a number of different partners, including UDOT. And I just have to call out Angelo for his support of this project. He has just been a fantastic partner, keeping us on track with our transportation indicators and moving forward with this project. And it's just been really fantastic. So this is a project that we're working on with the Public Health Alliance of Southern California, and they currently have an index called Healthy Places Index, which is for California. And coming soon in the fall, we will have a Utah version of this tool. And on the slide here is just screenshots, but the way that the tool works is that you can, the Healthy Places Index is a composite measure of kind of what Elizabeth was referring to before, like a quality of life index measure. And so it's taking these 25 different indicators in domains of social determinants of health, one of which is transportation, but also economics, education, social environment, neighborhood, and it gives a combined score for census tract, or in our map case, we're going to have Utah small area as a demographic option on there. But here in this map here, you can see by census tract. And if in this screenshot, I had clicked on automobile access. So that's what you're seeing on the map here. And so you can see for a particular community, what's the score, the Healthy Places Index, and what is this particular indicator in this community. So we will have a Utah version of this. And then in our Utah map, we were able to work with a number of partners, and I think a lot of them are on the meeting today, to identify some additional transportation related indicators that we felt were important to give context to the communities in our state. And those are in the top right there. So we've included a walkability index, motor vehicle crash and injury data, access to frequent transit, access to parks, and then affordable housing and transportation cost, as a tool to use on our map to be able to look at a community and say, what are the conditions within this particular community related to transportation? And then, so next slide, Angelo. When you click further into the map, you, in a particular area, you can get policy recommendations. And this is a really important part of the tool. So it's not just saying, like, here's what the conditions in this community look like, but it's giving some evidence-based policy recommendations to address that in that particular area. Another kind of, I think, really neat feature of this map is that it's positively framed, and that comes in a number of different ways. One is the color scheme. You can see that's greens and blues. They don't use reds or oranges or colors that might make it visually feel like a community is in some way lacking, but it's really trying to highlight some strengths in the community and areas where there could be improvement. So it's a positive framing, which I think is a really important piece of the tool. So the policies come in kind of a number of different areas, and you just kind of click through that, Angelo. So if you have a transportation related indicator, there'll be some transportation related policies, things like supporting walking and biking, increased transit, discount passes, things that I think you're familiar with. But also in that, there are planning related policies, so around growth and smart growth. And then included as well are social related policies. So what are the policies that could be put in place that help community members advocate for changes within their community? It's meant to be a tool that's used at the community level. It's not state agencies coming into a community saying, here are the problems that you have and here's how we think you should address it. But for community members to say, what are the assets and resources within our community and where are the places where we can make some change and have the power to be able to do that. So we're really excited about it. This is just, again, a screenshot digging in a little bit deeper to those policies. I know it's a little bit hard to read, but on the website, you can get some more context for how that policy would be put into place. All right, next slide. And it includes some things like this. So if you're thinking about making roads and paths safer for bicycles and pedestrians, or safe routes to school, active transportation plans. So just a number of different ways to improve transportation related conditions within a community. And as you look through this list, you can see that none of these are things that happen in a doctor's office or in the healthcare system. And while health departments have really played a larger role supporting active transportation in recent years, these are really things that, for the most part, are decisions made by local governments, county governments, and transportation agencies. And so when we talk about the interconnectedness of transportation and health, you can see here that that's so important to have transportation and local governments as our partners in this work because of the impact that decisions that they make have on the community. Okay, next slide. So it's really for us about addressing equity and trying to improve equity in our communities so that everyone has the opportunity to reach their full health potential. And I'm sure you've seen this before. This is a Robert Wood Johnson Foundation image, and it just feels so appropriate because it highlights the biking options here. That the point is not to give everyone a bike, but to give people the bike that they need, that meets the needs that they have. And these types of efforts, the quality of life indicators, these large policy changes are really complex and difficult, and it takes the work of lots of different partners. And that's why I'm so excited to have the Department of Transportation and Move Utah working together on this effort, because it really is the partnership and the collaboration that's important to try and advance equity within our state. Okay, that can be just passed right through. That's our notes. And then back to Elizabeth.
Thank you. So you're probably getting the picture by now that no matter how you look at this, no matter which framework you use, it's clear that transportation is one of the many elements that fits into good quality of life, like living the good life. I just wanted to share a little bit about UDOT's evolution. And I think it's just important to understand that we started 8 years ago at a place where our relationship with transit was tenuous at best, and we've come a long way. This program, Move Utah, the strengthening of TravelWise, this relationship that I have with Sarah and the work that we've done over time, all of that indicates movement in the right direction. And it's really been quick movement when you think about it in the grand scheme of things. So I do want to just talk about the background that I think is the start of the phase that we're in right now, and that is Utah's transportation vision. So in 2018, a lot of you are probably aware of SB 136. It was the bill that reorganized UDOT. It made changes to governance at UTA. It introduced the road usage charge program. It did a lot. It was like a 200-page bill. But one of the things that we were required to do was set out some strategic goals for the statewide strategic initiatives. And so it was a collaborative process, and we really made an effort to be more inclusive. We had this goal of radical inclusivity. And today, I would say that this is just the way that we do business, that we would never think of a big initiative where we didn't include representatives from the health industry, in the health sector. But we did invite them, and that was relatively new. We had this group that represented different parts of that quality of life framework beyond just transportation. Because when you look at that healthy life index, I think healthy places index, I think that is where it's the clearest to see all of these different factors that are contributing to overall quality of life. And you need everyone in the room. So what we did was focus on how transportation relates to that full picture, that full interconnected picture. And so this framework right here, we at UDOT don't believe that this is inclusive. We know that the broader indices are really representative of overall quality of life, but we're focusing on the areas where we think we have the most impact, and then developing measures, performance measures for those. And so it was this collaborative process over months with various committees looking at different things. And these are the dimensions that we arrived at. So good health, better mobility, strong economy, and connected communities. And that brings us full circle. If you'll go to the next slide, Angelo. That is what led us to our quality of life mission. I mentioned that it was in 2019. So all that work for Utah's transportation vision, which we affectionately call U-Vision, turned into this mission statement, the backbone of everything that we're trying to do right now. And as that evolution continues, a focus right now is thinking how we can create a system for all users that allows for safe choices. Now, the perspective that you have from a vehicle when you're driving along the road is very different from the perspective that you have when you're using the system in any other way. And that means that we need to take the time to look at the system from all those different perspectives. Just going to share a quick story because it really stuck with me. It is about Carlos, our director. His wife, Lori, is very, very active, and she was skiing. She broke her pelvis. So this was a big change for her. She couldn't walk by herself. She was in a wheelchair for weeks, and she couldn't go out by herself. Carlos would take her out for walks so that she could see the outdoors, because she can't survive without that. It's very negative to her well-being not to have access to the outdoors. And so he would push her along the sidewalks in this wheelchair. And he mentioned that even when there were changes in the grade, so like if there was a gap between two planks of sidewalk that was within the tolerances of design, so it's allowable, it's okay from a design perspective, those changes could make the sidewalk basically unusable. He's an able-bodied adult man who was pushing his 100-pound wife along. If she had to do that by herself, those sidewalks would not have been usable to her. And so this is one area where we talk about well-being, the subjective element of quality of life. She lost her autonomy. She couldn't go out and use the sidewalk. She couldn't go out and be in the outdoors and be active without help. That feeling of losing your freedom, losing your self-efficacy, not having autonomy, that is very negative to subjective well-being. And then there are the objective impacts to her quality of life. She had limited access to some basic needs. She couldn't go to the grocery store by herself. She wouldn't have been able to go to appointments with a doctor on her own. And so it was just really illustrative of this seemingly small thing. And luckily for her, it was short term, but how it completely changed Carlos's perspective on how we look at things, because what is allowed in a design standard is not the same as what we should do. So this is a picture from a new, I think it's fair to call it an initiative that we're calling Walk the Project. And this is a photo of a project team on Wall Avenue in Ogden. It was taken last week. This is something that's been germinating for a while. There are some of us who have been plotting over time to get this to happen, and now it's becoming more integrated into our process. But the idea is very simple and aptly named: go walk the project. See what a project area looks like to users of all kinds before you start to design and construct it. And so this, to me, is a physical manifestation of that growth that's been happening over time. I mentioned it before. It's kind of like watching a plant grow, like day to day. You don't necessarily see a lot of change, but when you step back after several weeks of watching a little seed grow into a seedling and then into a plant, you notice what a big change it is. So when I see this, I'm really excited for how much growth is going to happen over this next season and seasons to follow. And I'm excited that all of you are going to be part of it. And we wanted to do some question and answer, and I think Angelo is ready for that conversation. So I'll turn it over to you now.
Yeah, thank you, Elizabeth and Sarah, for the great presentations. And so, yeah, I'm trying to follow the chat, but I realized I was sharing the screen, so I quit following it because it was taking over the screen. So I have a few questions to get it started, and then I will also monitor the chat real quick and see what I can glean from there. Okay. And I know you guys were really nice to me during your presentations, but I won't be so nice with my questions. They might be hard, and so do your best to answer those. And so, do you think it's possible to achieve possible health outcomes through transportation policy and joint health and transportation policies? I know you talked about it. Now I'm saying, can we achieve possible health outcomes with these policies? And both of you can answer.
Yeah, I can start. I think yes. That's, we want to see these policies in place so that we do impact health outcomes. It's difficult to say, if we have, let's say, more comprehensive safe routes to school programs, that's going to mean X happens, or we reduce childhood obesity or something like that. We really can't say that. But I think what we can say is that when communities provide those opportunities for residents, that allows them to then be more physically active. We can do that more with air quality impacts, environmental impacts, things like that. We can see a more direct link. But because of that really complex interconnection, it's hard to say, do A and B will happen, but I think what we do feel really confident saying that making those changes will have a positive impact.
Couldn't agree more. And I'll pile on by saying that I believe that change is really going to have to happen at the policy and systemic level. I mean, when you think about how infrastructure influences a community, it's in a way that a lot of times is almost invisible. You have to ask people the question, and then they give you answers like what we saw in our public opinion research. They'll tell you, yes, it makes a difference. But when you ask it a different way and you say, when you think of your overall quality of life, what are the factors that are most important? Transportation is pretty far down the list. So people don't think of it unprompted. So I think at a ground level, we're going to need to do things at communities, but there are going to need to be policies and frankly funding that accompanies that to make change possible.
Okay, thanks. We have a great question that's really up to current present life here, guys. The nonprofit I volunteer with has wondered how we can help the quality of life for refugees because of their transportation issues. For example, they can't get a driver's license. Any thoughts there?
Yeah, that's a really great comment, and really helps to highlight the real world impact on people, particularly people without access to a vehicle. I think that's where our transit partners play a really important role in the accessibility and availability and cost of transit options that are really important to a lot of people in the state, but particularly those without access to a car. Also, there's in the policy guide that I mentioned earlier, there's things about shared mobility, shared driving services, things like that, and ways that we can really support those populations that are in the most need and that don't have that really readily available car access. And I think that's also really interesting way that UDOT has started to think about in recent years, that they're not just thinking cars, even though that's like the traditional, I would guess, the traditional way that, this quality of life framework is really out of that kind of traditional way of looking at transportation.
Yeah, and I think too, I don't want this to sound like a cop-out, and it just kind of is what it is, that we really are relatively early in this paradigm of thinking about transportation in the context of quality of life holistically. So I think it is accurate. Yes, sir. Accurate to say that traditionally it's been all about roads, all about cars, all about throughput. And this idea that we're moving people, not just cars, that's become part of our lexicon really in probably the last 6 years. So catching up with gathering data, both qualitative through having conversations with communities, so in person, hearing what they need, having dialogue, qualitative and then quantitative. So the work that we're talking about here, measurements that we're doing at UDOT, and really significantly what Sarah is leading up. We just need to start by understanding what communities need. I mean, when you asked that question, I was thinking, whew, that's a good one. I really have not given that much thought. There are so many questions that we still need to ask, and so many questions that we've asked that we still don't have data for. So I think we just need to be aggressive about seeking out answers to questions and acknowledge that we don't have a good understanding of where needs are. I think we're making good progress toward that. So we recently just completed, I would say it's a report, Angelo. How exactly would you define it? I'm thinking of the document that we just finished up with Claudia.
The transportation, it was a green paper on equity with transportation, and so the state of transportation, basically. And so when I saw that question, my first thing I thought of was, how can TravelWise help? You know, that was my first thought. Okay, so we have some work to do.
Yep. And I mean, I think it was really illuminating. That report is really illuminating. And it also made me think like, okay, we have so much work yet to do. This is a fantastic starting point, and now so many questions that we need to pursue.
Okay, this one's for Sarah. Is the trial version of the Utah Healthy Places Indices going to be accessible to anyone, or are we going to wait for the final?
Yeah, the trial version is not accessible yet. I did put in the chat a link to the California version, so feel free to get into that website and play around a little. I will, with the caveat that this is, they're doing an upgrade even on their own site in the coming months, and so it's going to change a little bit, and our version will be the upgraded version, and it will come in the fall. A couple of things though, that where we are looking for some input. So we've identified all of the indicators that are going to be there, but we have a little bit of flexibility in the policy guide. So we will have this kind of base guide that comes with the map, but we will have the opportunity to add some additional policies that we feel like are relevant in Utah. And so we're meeting with stakeholder groups around the different areas. We've had a meeting this week with food security partners and with healthcare access partners. And then we have upcoming a transportation related policy meeting. So I'll put my email on the chat. And if you're interested in attending that policy meeting, let me know. And, you know, like this question about refugee populations would be great to discuss in that meeting. Like, are there policies we can put in the map that help communities see how can we address some of these issues that might be relevant in particular communities? So that is an upcoming opportunity to provide some insight. And then over the summer, we will have the tool that will beta test. And so at that point, we will be looking for people to kind of play around with it, look at it, see how it works, and get some input then. So if you're interested in that as well, please just email me and I'll put that in the chat.
Okay, I'll go back to my question for a minute. And Elizabeth, you talked a lot about performance type metrics, and so I'm going to throw out, can we at a state level, do you think we can have joint performance metrics with transportation and health? So both the UDOT and the Department of Health have that as their performance metric?
Yes, like short answer, yes, I will expand. Really quickly though, I do just want to say, I don't know how many of you are taking a look at the chat, but Claudia really just did an enormous amount of work on that report that I mentioned. She really was the engine behind it, to use a transportation metaphor. So thank you, Claudia, for all of your work on that. It was a pleasure for our team to work with you. Okay, so as it relates to metrics, this is why I think that what Sarah is doing is so important. So I studied positive psychology at University of Pennsylvania, and my capstone was about quality of life measures related to transportation. And what I believe is that transportation measures cannot just stand on their own. We need to have them. We need to have those performance measures that, like, no doubt, those are really important too. But we need to also be aware that we fit into a greater context. Sarah mentioned that when we look at overall quality of life data, when we look at the index, there's going to be so much noise in it because of how everything is interrelated. And there are very few direct lines where you can say, we made this change and this is the exact outcome, because there are things that are interrelated, that they're mutually reinforcing either positively or negatively. And so I just think we would really be missing the boat. We would be ignoring reality if we didn't have integrated measures. So definitely between transportation and health, and I think also transportation and other aspects of the index, everything is interrelated, and we need to be having really serious conversations about where there's overlap and how we can support each other with the policies that are going to be the most effective.
Anything, Sarah, to add, or?
No, I agree. I think it just sort of reminds me of, Elizabeth, you said something about how at the time when you were doing the quality of life framework and had good health in there, it seemed like cutting edge, and now it seems like, really? And it's only been a couple of years. And that's so exciting. I think it's just so exciting that it feels more natural now, and I think the understanding is greater. And I mean, that really, I think goes back to the work that you guys have done on your team to do that and to make those connections, but also to the public health workforce, to the state and local health departments and nonprofits who have also been doing that work and who have been like constantly saying, don't forget us, you know, in these conversations. But it does feel so much more natural and connected now than even just a couple of years ago.
Okay, so adding equity to that same question, can we add equity into this transportation health metrics? So we have basically 3 groups that are from the state that are having shared metrics.
Well, I think you have to. I just, you can't do the work without addressing equity, and it would be incomplete, and it would be the wrong approach. So you have to.
Okay.
I agree. And there was a question in the chat, or maybe more of a comment, but about how it would be interesting to take a look at the public opinion responses if you were to break it down by different communities, if you were to look at underserved communities. And I think, I don't want to speak for Sarah, but I'm going to go ahead and speak for Sarah a little bit. I think that that's the goal, is that we would be able to get more granular than the census tract data. Like, that is a really great place to start. It is so much better than statewide. It's better than just doing rural, urban. I'm really pleased that that's where we're at. And I would hope that we would get to the point where we can eventually target different communities at it more precisely, so that we can understand what they need. As far as investing public dollars, there may be projects that are very, very inexpensive that best meet the needs of community. I mean, it could be positive separation for a sidewalk, and a sidewalk that's wider than a standard design, because what that community really needs is to be able to safely walk to grocery stores or to centers of healthcare, or likely to transit. That's a small investment. So to go in and presume that our standard project of redesigning a road and putting in standard curb and gutter would be the right solution would be a waste of money, and also not give that community what they need. So for us to be effective, and not only in achieving what a community needs, but also using money efficiently, we have to look at equity.
Okay, and then last question for you two, and then we'll call it. What do you think are next steps that we could take to garner support from the public, leaders, and decision makers in other sectors, you know, about the intersection of transportation and health?
One thing I think we have going for us is that it is really intuitive. When people hear about the work that we're doing and you talk to them about health, quality of life, transportation, like, people start nodding immediately. It's not really a super hard sell, because the right thing to do. It's right. So I think I'm a communications person, so of course I think this, but I think that the next step is to start communicating about what we're doing and why it's important and how people can engage. Because I really believe that as people hear about it, they're going to want to get on board. They're going to want to support it. They just need to know that there's a thing to support so that they can get on board.
Yeah, and I would just add, like, tangibly for this Healthy Places Index, there are some next steps related to this policy meeting I mentioned, and then we, in the late summer, early fall, really working to make sure it's a tool that communities use and engage with, and we really need that to be widespread partnerships. So we need, everybody who's interested helping to make sure that that's a tool that's available to communities, that they understand how to use it, that they can see how it will impact decision making, potential funding opportunities, those sorts of things. So it's a really tangible tool and product that we have, that we're working towards, and that we really want engagement with from a variety of people. But there's a lot of other things going on as well, and I think that people excited about transportation and health, there's a lot of places to do the work, and that's really exciting. And from from our perspective, there are, when we talk about social determinants of health, it's, from that model, obviously transportation is one of many. And I think the work that we have done over the past few years actually serves as a good model for other partnerships, around education or economics, employment, housing, that we can see some success in what we've been working on together here and use that in other areas as well.
All right, well, I want to thank all the people that have attended this, and thank you, Sarah and Elizabeth, for your wonderful presentation and discussion. So it's time to move on to the next one, you guys. So thanks.
Thank you.
Thank you.